Now, Professor Daynia Ballot, head of the Wits School of Clinical Medicine, says the continued closure of Charlotte Maxeke Hospital is a humanitarian disaster. In an open petition, Professor Ballot raises concerns over the rising health crisis in the Gauteng province, as the third wave is not showing any signs of slowing down. Well, Professor Daynia Ballot, head of the Wits School of Clinical Medicine, joins me now to expand further. Professor Ballot, very good afternoon to you. Thank you so much for your time. You've described the closure as a humanitarian disaster. Exactly how bad is it, especially as a person who works on the ground and understands the day-to-day demands during an unprecedented time such as COVID-19?
So I work for the university, but I represent the clinicians who work in the teaching hospital. So that's Charlotte when it's open, Chris Hani Baragwana for Academic Hospital, Helen Joseph and Rahima Musa Mother and Child Hospital are our biggest ones. And at the moment, the hospitals are not coping. The burden of the closure of Charlotte Maxeke Johannesburg Academic Hospital and the COVID wave are just too much for our services to withstand. Patients are not getting treatment. There are no hospital beds. There are not enough ventilator beds. Staff are exhausted and demoralized, and it really is an untenable situation.
We heard of the reopening, and that announcement came several times, and still the hospital isn't open. And there were also contradictions on when exactly it would open, with the acting health minister, Mamloko Ngubane, saying one thing, and Gauteng Infrastructure Development Department saying another thing. And when it comes to the patients who are in desperate need for this hospital to open, what are we looking at here? Because there were also calls for the oncology department to be open first.
So Charlotte is a hospital of national importance. It's not only provincial. It is a world-class facility that offers specialized services in a whole range of diseases. So, for example, not only oncology, but we've got specialized intensive care services, cardiothoracic surgery, hemodialysis, to name but a few. And all those services are impacted. They are either not being done, or there aren't enough facilities in the other hospitals for the patients to be treated. So, for example, if you have a cancer and you miss out on your radiation or your chemotherapy, the cancer can regrow and it may well become incurable during that time. There are not enough ventilator beds, so people that need ventilation cannot be ventilated. There are not enough beds for our newborn infants. We really need that hospital open.
The Gauteng government says it has enough beds. What has been your experience of clinicians like yourself when we talk about the importance and the need for more beds during this time?
So the COVID wave is putting enormous strain on the number of beds that we have. And the problem is when people talk about a hospital bed, it's not only the physical bed, it's also all the staff and equipment required to look after the patient in the bed. And we have a shortage of staff, particularly in the nursing sector. So we often don't have enough nurses to look after the patients in the beds. And we generally function at pretty much full capacity, even when we don't have closed hospitals and the COVID wave. So hospital beds are a challenge in our province at the best of times.
We know that a fire gutted, important parts of the hospital, 40% of it, to my understanding. To your understanding, what are some of the reasons following that fire and the other debates that are being had about why the hospital is still not open, even after several promises?
So I think one of the issues is the governance and management of the public facilities. So it's not just the Department of Health that looks after the hospital. The actual building is maintained and run by the Department of Infrastructure and Development or Public Works. And then the occupational health and safety is another government department's responsibility. In this case, the City of Johannesburg has to issue the fire compliance clearance.
And so you've said, put out this petition, and you're calling for something to be done very urgently. You know, why is it so close to your heart, and why stand out and make the petition to begin with?
As I said, because as the head of the School of Clinical Medicine, I represent all the doctors working in all these big hospitals. And it's difficult for them to speak out because they work for the province, whereas I work for the university. And truly, the situation is desperate. This is an unprecedented situation with the fire together with the COVID wave, and the doctors are desperate. And we most of us care deeply for our patients, and our patients are suffering. And it cannot go on like this. We need to urgently reopen the hospital.
And the piggyback effect, so to speak, with the patients being moved to different hospitals and having to then queue and start processes, you know, without really maybe knowing where and how to move around the different hospitals. How much of an impact do you believe that it's having on their own health and perhaps their psychological well-being?
I think it's having tremendous negative impacts because, you know, many patients are long-term patients of the hospital. So if you have a chronic condition, you've been used to going to the hospital, which is probably convenient to where you live. You're used to the staff who look after you. I know of instances where patients haven't known where to go and have delayed in getting emergency treatment. Also, the capacity of the other hospitals to absorb the Charlotte patients is limited. So many of those hospitals don't have the beds and the facilities that are required for treating complicated illnesses. Many of them simply don't have enough beds, so patients are waiting long times in casualty, trying desperately to get a bed.
And very lastly, before we let you go, Professor, how can people join you in your call as you put out this petition?
They can sign the petition and share it with their friends.
Have you had any sort of response from the health department?
I haven't closed the petition, so I haven't actually presented the petition to the health department, but it has been. They have referenced it in some of the news releases that they have made.
Mm-hmm. Very well. All the best to you. Thank you so much for your time. That is Professor Daynia Ballot, head of the University of Wits Clinical Medicine Department, really just calling for Charlotte Maxeke to be reopened.